I'm going to talk about composing and filling the care plan for patients with cardiac and peripheral vascular disorders. We're going to take a look at a scenario. A 55-year-old male comes into the ER with complaints of 9 on 1 to 10 scale, chest pain that radiates from breastbone to left arm and up to his jaw. The patient stated that he started 6 hours ago and he thought he was having a heartburn, but it has got worse and he is now experiencing shortness of breath on littlest activity. He states his father died of a heart attack 10 years ago. Vital signs: heart rate 101, blood pressure 186/101, oxygen saturation 95% on RA, respiration rate 22, and temperature 98.6. The patient is given nitroglycerin 0.4 mg sublingual, 1 tablet, 2 mg of morphine, and placed on 2-liter nasal cannula. Lovenox 1 mg per kilogram is ordered as well, and this is given. The first set of troponins are 2.58. Cardiology is consulted and the patient is kept MPO pending heart cath if ordered by cardiology. The EKG shows slight ST elevation and the patient states his chest pain is now an 8 on a 1 to 10 scale and states the pain is still there. It has been 5 minutes since his last sublingual nitroglycerin and his BP 176/98 and heart rate 100, so you give the patient another sublingual nitroglycerin. The nursing diagnosis: acute pain relating to myocardial ischemia as evidenced by patient rating pain 9 on 1 to 10 scale in the chest and troponin level 2.58 and EKG ST elevation. Subjective data: a 55-year-old male patient comes into the ER with complaints of 9 on 1 to 10 chest pain that radiates from breastbone to left arm and up to his jaw. The patient stated that he started 6 hours ago and it got worse and he is now experiencing shortness of breath on littlest activity. He also states that his father died of a heart attack 10 years ago. The patient states that his chest pain is now an 8 on 1 to 10 scale and states the pain is still there. The objective data: vital signs, heart rate 101, blood pressure 186/101, oxygen saturation 95% on RA, respiration rate 22, and temperature 98.6. The patient is given nitroglycerin 0.4 mg sublingual, 1 tablet, 2 mg of morphine, and placed on 2-liter nasal cannula. Lovenox 1 mg per kilogram sub is ordered as well, and this is given. The first set of troponins are 2.58. Cardiology is consulted and patient is kept NPO pending heart cath if ordered by cardiology. An EKG shows slight ST elevation. It has been 5 minutes since his last sublingual nitroglycerin and the blood pressure is now 176/98 and heart rate 100, so you give the patient another sublingual nitroglycerin. The nursing outcomes: the patient will report a decrease in his chest pain by rating his chest pain less 3 on 1 to 10 scale. Troponin level will be drawn every 6 hours times 3 times, and any abnormal values will be reported to the cardiologist immediately per medical department order. The patient will maintain normal sinus rhythm during hospitalization. The patient's SBP will be greater than or equal to 110/130 and heart rate 60/100 during hospitalization. The nursing interventions: the patient's vital signs will be monitored every 30 minutes by the nurse. The nurse will assess patient chest pain every hour and educate patients on reporting an increase in chest discomfort to the nurse immediately. Troponin levels will be drawn at 0200, 0800, and 1400 per medical department order. Nurse will administer nitroglycerin 0.4 milligrams sublingual every 5 minutes for chest pain until relieved. The nurse will obtain an EKG when the patient reports chest level and report any ST elevation to the medical department.